Welcome back to Let's Talk Autism with Shannon and Nancy. And now we are going to be joined via Skype with Dr. Liz Matheis, who is a clinical psychologist and certified school psychologist. And she specializes in assisting children and their families with ASD and all the problems that can sometimes come with that, like anxiety and learning behavioral disorders. And welcome to the show, Dr. Matheis.
Thank you so much for having me. I'm so happy to be here.
It's good to have you here. And we were also talking just before we brought you on that you kind of offer one-stop shopping at your practice because you have several therapists with different areas of specialty working with you.
Yeah, given that I'm a clinical psychologist and school psychologist, I served my time on the child study team, so I understand how IEPs are written, I understand the testing, how it turns into programs for the kids and related services, accommodations. So I really took all of that knowledge when I chose to go into private practice and to use it. I got frustrated being on the child study team. You know, there's only so much that I can do, but in private practice, I have a lot more ability to work with the families and address the home and the school and to put everybody on the same page, which I really love. I love putting everyone together, so we're thinking holistically, because I'm not a big Band-Aid person. I like to really address the child as a whole and the systems as working in coordination.
In fact, you've got people who tell us about some of the different techniques that you have in your office, because you said you had play therapy. Tell us all the different things that you've got in your office.
So I'm very, very blessed. The practice has grown, and I have 4 therapists in total right now. I have one, her name is Chrissy Sundberg, who does ADHD in-home coaching, which is a new service to us, basically going in and working on executive functioning skills, but also behavior management, even if it doesn't relate to ADHD. We also have Stephanie and Nicole, who work with children from school age, basically up until 21. And they do a lot of play therapy and art therapy, and they're so wonderful and patient and kind. And I also have Michelle, who she and I have worked together in the past, and she's a certified play therapist. She uses the Santre therapeutic technique, which is a really awesome way of processing just emotions and trauma for children, and she brings that wonderful skill to our practice. And so we do offer a multitude of services, and for any point that it changes in a child's life, they can always come to us and we can meet their needs in different ways. I do a lot of parent coaching, so I will go over IEPs, I'll test, all of that great stuff to really help parents keep track of the big picture and think about what is the next step, what other information is needed, and how can we incorporate this into the child's program so it's meeting the school-based program is meeting their academic, their behavioral, their emotional, social skills. We have a comprehensive program.
Absolutely.
How do we know what type of program a child with ASD needs in school? How do you determine that?
That's a big loaded question, right?
Yes.
So let me just start with every child is entitled to an appropriate education. And when you look at a child on the autistic spectrum, we have to look at their profile, as well as the academic programs and accommodations and related services that are available to the students. And by related services, just to clarify, that's speech, occupational therapy, physical therapy, and counseling in the school setting. And when I say profile, I mean taking a look at the child's academic skills. How are they functioning academically in terms of reading or writing or math? What are their strengths? What are their weaknesses? How do we use their strengths to compensate for their weaknesses? And what's their learning style? That's a big question that I like to answer, so that when we're taking that child's information to a teacher or school, we're saying, this is the kind of learner that the student is, so let's not reinvent the wheel, let's try to minimize frustration. I also think of a child's profile as social skills. How social is the child? What are their areas of passion? Who do they enjoy interacting with? Do they enjoy interacting with mainly adults, younger peers, older peers? And what kind of things do they enjoy doing with other kids? So that's 2 main areas right there, the academic skills and the social skills. The emotional skills is another area. Is this child anxious? Are they inattentive? Are they aggressive? These are all things to take into consideration. Behavioral needs. So does a child have environmental triggers or internal triggers? Do they need a high, medium, or low level of support on a daily basis just to get through the day? And finally, I think of profile being also sensory needs. That's a very big part of any child with special needs profile, not just ASD, but sensory needs. Is there a sensory processing disorder? And if there is not, what are this child's sensory needs anyway? So are they sensitive to sight or sound? Do they need deep pressure throughout the day? Do they need movement breaks? Do they need time to decompress during the day? So just to begin, these are all the variables that I feel like they need to be considered when we're looking at a child's needs and their academic arena, where they need to be. So
I love that. I love that you take all those things into consideration. But then from there, a lot of parents go to the school and they sit down and have the meeting, and the school will tell them about one program that they have. And most of the time, a new parent especially has no idea that that is a choice and that there are other choices to choose from. So I think, first of all, I would imagine that having you on the team, that you are aware of all the other things that they could have been offered. But even for the parent that does get offered more than one thing, a lot of times we don't know what to choose. So then I'm assuming that you tell the parents all of the choices and then help them to pick out what's appropriate?
Right, and we do that all before the meeting. So we'll sit down and, when we sit down for the intake, I'll say, provide me with all this information. Let me get an understanding of the whole picture. Now let's take a look at what kind of academic support your child is going to need. Sensory support, social support, emotional support, behavioral support. Now your district may be saying, okay, we have this one class or this one program. Well, the beautiful thing that I think a lot of parents don't know is that there is latitude. It can be modified to an extent. But, the one thing I do know from working in private schools and public and private, is that public schools sometimes don't have as much flexibility because they have a structure to go by. And in the private schools, you have a lot more latitude, really the bottom line. So there's a whole bunch of options available to students, and it really is an art. It's not a science, it's an art. It's a big dance that you do, and knowing that there's no one-size-fits-all program for any child, and it takes a lot of dancing, which I'm more than happy to do and hope that the school joins me. But the way I see it, that there's a whole bunch of different options. There's the self-contained classroom, which is the most restrictive. And that's one classroom. It's a small group of students, and they're there for all their academics. They generally will travel together for all their specials. They may join their general ed peers for lunch and recess, depending on how much need that there is, or if they need more support on the playground or at lunch. Then there is the resource pullout for all the major subjects, which is a separate classroom for a smaller group of students, but they stay there mainly for their academics, and then they leave and join their general ed peers for their specials, lunch, and recess. Then there is the in-class resource, which is general ed and the special ed teacher co-teach together for particular subjects. Let me take one step back. The resource pullout can also be for individual subjects. So it can be for all subjects or just a few subjects. And the child comes in and out of that environment and goes back into the general ed environment. Then the next option is general ed with paraprofessional support, which is a paraprofessionals in the class who provide support to either all the students in the class or to 2 or 3 and is then noted as a shared aid, or a paraprofessional that is there for one particular child, and that's a one-on-one aid. And then your final option, which is the least restrictive, is general ed with no support, where it's just the child is in the class with the teacher. So that's all within the public school environment. The private school environment, that's the out-of-district, that is the most restrictive because there isn't very limited exposure to general ed peers, if any at all.
So the
It's a big menu.
It is a big menu, and the $64,000 question is, though, that we see a lot of times, that inclusion on some level would often be the best choice for an individual, but are the teachers prepared to facilitate that? Do they have the right training? Are they equipped to deal with that? And what's your thoughts on that?
So having worked in both arenas, our general ed teachers have had such an increase in the number of children with special needs, with autism, with ADHD, anxiety. The number of students over the last decade has increased immensely. They're not just teaching that general ed child. I really don't even know what a general ed child is. I just know that they're in the classroom, I guess. But they are not always trained. Their needs have grown so much. From what I understand, and I hope this has changed, but when I was in the public school, I asked the general ed teachers who were new out of college, and I said, so tell me, how many classes do you have to take in the arena of special ed? And they shared with me that it was very few. And so sadly, a lot of them do come out and there isn't that much training. So it's really up to the district to then shape that professional to understand the needs of that particular child or particular classification of children, because they're not always equipped, and they certainly can't do it by themselves. They absolutely are going to need more support in the classroom, whether it's another teacher or a paraprofessional, but they need more support because it's hard enough to have to differentiate instruction for any student, and then you have a class of 20-something. So if you're differentiating work all day long, when are you teaching?
It's tough.
So I think it's a very, very, I've always said this, that the people with the hardest jobs are the teachers and the paraprofessionals, because it's a big balancing act where they're trying to meet everybody's needs in the best way possible, and it's hard.
Well, clearly, though, and I agree, I'm an ex-teacher, but I also feel like all of the things that you just said, which are so amazing, it's so overwhelming to a parent, which is all the more reason why we should avail ourselves of the services of somebody like you. So let's take just a second for you to talk about where can people reach you, what kind of clients are ideal for you, how they can get a hold of you.
They can absolutely reach me via my my website. I encourage everybody to go and take a look, especially when they're trying to figure out who's my best match for my child, therapist-wise. I can be reached at Dr. Liz at psychedconsult.com. The website is www.psychedconsult.com. I also have a phone number. I'm happy to share that. That's 973-400-8371. For those who may not be in state or are in state but far away, I also Skype and FaceTime to make the services accessible. And as I said, I do travel to the children's schools and work as a member of the IEP team so that we can work collaboratively. I don't go in there with any intent to brawl it out. I really just want to work collaboratively to find that best program. And absolutely, reach out. We'd love to hear from you. And even if it's on just a consultative basis, to give you a little information as you're going into an IEP meeting, whether, if you're out of state, clearly I may not be able to go with you. But for parents who I'll bolster a lot of parents and say, here's your list of questions. Make sure you come out of that meeting with these answers and make these requests, because they are within the scope of the special education law, and you have a right to this, but unfortunately, you have to ask for things by name.
And so then they don't have to be in the state of New Jersey to call and have the benefit of at least some of your services.
Correct.
Wonderful. And so, the wide variety of people that you could see, then I'm thinking, and Nancy hasn't said this, I'm going to say it for you, that her husband passed away almost 2 years ago now, and her son was 14 at the time, and it was a rough time, and trying to find somebody who could help her through that time.
Grief therapy for my son.
Exactly, but understood autism. Right. That was an uphill climb to find somebody.
I found one person that we worked with for a very short time, and that was it.
And I think that you're not the only person to be going through that. That's
Right.
one of the things that you cover. Who give us a list of what kinds of people would be ideal for you, that you really could make a difference for.
Well, anybody who is looking for parent coaching, even if it's just help me create routines for my children at home, help me review my child's IEP, can you test my child, can you read my child's evaluations and help me make sense of what they mean, support me. This is
Right.
hard.
Yeah, it's a little
This is a
overwhelming.
hard journey. It's a very, very hard journey. Not just as a professional, but as a mom of a child with special needs, it's exhausting, and we need support. And I know I like to bounce ideas off of somebody else and say, am I approaching this in the right way? What can I do to be a facilitator of my child's well-being while mine is being compromised? So it's a very tough journey as a parent, and these are the hard parts, and we have to support each other and help each other. So I really say that to all parents. If you need help and you need to just process, even if you're not bringing your child in and you're just saying, talk me through this next IEP meeting, help me handle this upcoming situation, or my child is behaving this way, or I don't know how to make sense of the test results, because it's gibberish if you aren't trained in it.
It's a wonderful resource that you're providing. Let's put the website back up again, and if you would like to, Dr. Liz, tell us the phone number again where you can be reached.
Thank you so much. 973-400-8371.
And again, for those of you listening on iTunes, psychedconsult.com. Psychedconsult.com. Dr. Liz, we want to thank you so much for being with us today.
Thank you for this wonderful opportunity.
Yeah.